Right now on Fox 43 News at 10. 2 years later.
Moving forward does not mean ignoring COVID-19.
We're still coping with COVID-19 changes daily, from overrun hospitals and burned out healthcare workers.
I have nightmares every night. If we don't support each other, we will never get through this.
And long-term virus effects.
Oh yeah, yep. Just a lot of fatigue and stuff.
To continuous questions about vaccines, treatments, and testing availability.
We want people to stay informed. We want people to stay connected, and we want people to stay safe.
While there's still plenty of uncertainty surrounding the virus,
as far as the future of the pandemic, I think a lot of that relies on us.
Health officials in South Central Pennsylvania and across the nation hope the latest drop in surging cases and hospitalizations from the Omicron variant is a sign of hope for what's to come next. Tonight marks 2 years since the first 2 cases of COVID-19 were identified here in Pennsylvania. Thanks for joining us for this special edition of Fox 43 News at 10. I'm Evan Forrester. It also marks 2 years since Governor Tom Wolf signed an emergency disaster declaration in response to the COVID pandemic. And while COVID trends show hopeful signs as we enter a 3rd year of the pandemic, it's important to highlight the crucial moments of where we have been to thoughtfully try and navigate where we are going.
This has been a tough year. I'm not sure that there's anybody in Pennsylvania who isn't frustrated.
That was 1 year ago. Fast forward to 2022, and the sentiments remain eerily similar from the Wolf administration as cases hit record highs in January.
This is a stressful time of year anyway, and then there's a big pile of COVID cases on top of it. It just complicates an already complicated situation.
Looking at the COVID trends through the last 2 years looks a lot like a roller coaster. Health experts like WellSpan infectious disease specialist Dr. Eugene Curley agree.
A lot has changed over the past 2 years.
State Department of Health officials have recently touted the decreasing number of COVID cases and hospitalizations in Pennsylvania.
As you've seen in our weekly COVID-19 updates, Pennsylvania is moving in the right direction.
They say it's largely due in part to people being vaccinated. However, just like case counts and hospitalizations, Pennsylvania's vaccine numbers are starting to waver.
I think the biggest trends that come to mind, again, what we've been talking about is just the low numbers of vaccination across Pennsylvania.
About 67% of Pennsylvania's population is fully vaccinated. Health officials say for the Commonwealth and the nation to stay on this positive path of COVID trends, people have to become naturally immune. And that happens easily with full vaccination. And the longer the time without widespread natural immunity, the more time for additional variants to occur.
We don't want that to happen. We want people that are out there right now that are eligible to be vaccinated. If you're eligible, we want you to get vaccinated now.
And we'll hear from Dr. Curley a number of times throughout the hour about concerns that still do remain concerning COVID-19. Meanwhile, virus testing has ebbed and flowed as we have dealt with different COVID-19 variants since the first cases popped up here in Pennsylvania. From waiting weeks for results to now just seconds, Fox 43's Jackie DeTore finds out how testing for the virus has changed over the course of the last 2 years.
We received confirmation of 2 presumed, and I emphasize the word presumed, positive cases of COVID-19 or coronavirus in Pennsylvania.
2 years ago today, that's all we knew.
Now I'm saying presumed positive for a reason, because the results have to be confirmed by the CDC.
There have been more than 2.2 million confirmed cases in our state since then. But on March 6, 2020, getting a COVID test was nearly impossible. At the time, the only place in the entire state that could test for the coronavirus was at the Department of Health State Lab in Exton.
We are continuing to increase our testing capabilities at this state laboratory, and we are also aware that commercial labs are coming online to also begin testing.
That was then when Dr. Rachel Levine was the Secretary of Health for the Commonwealth.
It was very challenging about the limitations in testing that we had in the spring of 2020 as we were trying to work to contain the virus and then to stop the spread and bend the curve. Remember all those terms.
Now she's known as Admiral Levine, the Assistant Secretary for Health under the Biden administration. Not only has her title changed, but the way we test for the virus has changed a lot too.
Now we have 20,000 sites throughout the nation.
But 2 years in, we're still not perfect. The Omicron variant hit the U.S. hard. Testing companies, sites, and labs were all overwhelmed. People were waiting hours just to get a test and days to get results. Pharmacies were either sold out or limiting the number of at-home tests you could buy.
Why were we not prepared in that moment for the influx of testing that we needed?
It took a number of weeks or a month or more to gear up the manufacturing and the distribution for those tests. But we are going to make sure that if there's any further variant, that through ASPR, the Assistant Secretary of Preparedness and Emergency Response, and her team, that there are tests available for the United States to be able to deal with any future variant that might occur.
Part of the plan to make sure that doesn't happen again was to send at-home tests to Americans.
We have bought 1 billion tests to send to Americans for free.
But at the end of last month, more than 200 million tests have yet to be claimed. A big reason why is because the COVID-19 numbers dropped dramatically and other people just don't want to test anymore. As for the future of COVID-19 testing, Levine says it's constantly evolving to be more accurate and simple.
You know, the president has made it very clear that we are moving towards a time when COVID-19 will not disrupt our daily lives.
As we evolve, so has Levine's message to Pennsylvanians. Back in 2020, it was a lot of this.
Stay calm, stay home, and stay safe.
Now, 2 years later,
we want people to stay informed. We want people to stay connected, and we want people to stay safe.
And if you have a consumer story or scam you want me to look into, Fox 43 wants to find out. Let me know. Email fox43finds@fox43.com or join the Fox 43 Finds Out group on Facebook.
And hospitals are emerging from another wave of COVID-19. Omicron cases are fading, but severe staffing shortages are pushing healthcare workers to the brink. Fox 43's Rochu Yankunis spoke with doctors and nurses about what it's like inside Pennsylvania hospitals 2 years into the pandemic.
A lot of people ask me, why do you stay, Erin? And I stay because this is my family.
You can't beat that.
No, you can't beat that. Hanover's my home. It's my home.
Erin Schock is an ER nurse at UPMC Hanover, healing the very community where she grew up. But the pandemic has forced nurses like her to make heartbreaking decisions.
I have nightmares every night. We would have to decide who would get beds first or who was going to get which hallway bed first. I've held people's hands that have died in these rooms that I've known, and I get a text later that tell me, I'm so glad you were there, Erin. It helps me know you were there. That's why I stay.
Because they couldn't be there.
Because they couldn't be there.
But so many nurses are leaving the bedside. Hospitals are seeing a staffing crisis, pushing nurses that are still left to a breaking point.
So many of our nurses have worked tons of overtime, anywhere from 50, 60, 70 to 72 hours a week to fill in holes.
For nurses in the ICU, waves of new infections and deaths are leaving them exhausted. Statewide, less than 30% of ICU beds are available.
Comparing the number of patients that do get better and do make it home to those who don't, what's that ratio? How often does that happen?
More patients than not do not make it home once they come down here. I love caring for people. I love being part of this community and knowing that I'm making a difference in this community. But it gets really hard. We all got into this job because it was our passion to help people and see people get better. Most of the time, it's a losing battle.
Hospital staff is stretched thin even as Omicron begins to fade. But a drop in cases means hope is on the horizon.
Unfortunately, we don't know where this will go. But we are taking the opportunity to take a breath and kind of regroup.
Have there been any rewarding moments?
Absolutely. That camaraderie that we've developed, that teamwork that we've developed has been incredibly rewarding. They have given blood, sweat, and tears throughout this process. So I just think it's really important that we continue to thank those healthcare providers.
In search of learning what it's been like inside hospitals during the pandemic, we found what has been holding healthcare workers together.
There's our team. Love you. Love you guys. I am so proud to save lives beside my coworkers. They are top notch. I just would shout it from the rooftops if I could.
And our healthcare system is depending on people like them. I'm Rachel Yankunis, Fox 43 News.
And still to come, we'll hear more from people in South Central Pennsylvania who had COVID and are still dealing with some side effects. And ahead at 10:30, details on treatment options for those who are still suffering. Plus, as cases drop and COVID precautions ease, a number of families may be wondering when their youngest members can get the vaccine. Still to come tonight, we'll have a look at the latest timeline of when to expect shots for children as young as 6 months of age. Plenty of questions surrounding COVID vaccines continue to linger. For the latest information on each shot, text the word vaccine to 843-0043, and that'll get you the Fox 43 COVID vaccine guide. Stick with us, the special edition of Fox 43 News at 10. We'll be right back. As COVID-19 cases decline and restrictions ease, one big question does remain. When will children under the age of 5 be eligible for COVID vaccination? We take a closer look at the latest data and a potential timeline for when a shot could be available. Most recently, a U.S. decision on Pfizer and BioNTech's vaccine for children 6 months to 4 years of age was put on hold. An FDA committee was scheduled to discuss emergency use authorization of a 2-dose regimen for the age group in mid-February. However, health officials said they needed more data on a 3-dose process as well. While FDA officials did not announce a new date for the advisory committee meeting, Pfizer said in a news release that they expect to have updated data by April. And as for the other 2 vaccinations approved in the U.S., Moderna said it expects to report data on a shot for kids ages 2 to 5 sometime this month. Johnson & Johnson said in January trials are underway for young adults between 12 and 17, though the vaccine is not currently authorized for children. And while parents question if children really need the vaccine as kids get more mild symptoms, the most recent data from the American Academy of Pediatrics shows more than 120,000 child COVID-19 cases were reported the week of February 17th. That accounts for more than a quarter of weekly COVID cases in the U.S. Meanwhile, a recent study shows the low-dose version of Pfizer's COVID vaccine approved for younger children appears to be less effective than the higher-dose version of the shot given to teens and to adults. Some doctors say the data could push CDC officials to require a 3rd shot for the younger age group. The White House recently laying out plans for the country to safely move on to the next stage of the pandemic. More details for that story coming up. Stick with us. We'll be right back. White House officials recently outlined a plan they say will allow people to return to normal activities safely after 2 years. The main goal is to focus on preventing serious illness. The 90-page National COVID-19 Preparedness Plan explains how to do that while preparing for potential new variants. A big highlight of the plan is a test-to-treat initiative where people will get free antiviral pills at pharmacies if they test positive for the coronavirus.
We will have to contend with COVID at some level for some time to come. Thus, we will continue to invest in research to develop better treatments and next-generation vaccines.
In terms of restrictions, the latest debate is whether to drop masking mandates on public transportation. That is set to end on March 18th. An Adams County couple continues to share their story of COVID struggles with Fox 43 in hopes of encouraging those who remain unvaccinated to think about getting the shot. David Lopes was diagnosed with COVID in March of 2020 and was WellSpan Health's first COVID patient. David was unconscious for 17 days as the team at York Hospital worked to keep him alive. His wife Colleen says she wants other people to get vaccinated if they can so they don't have to experience the heartache that she did.
If that can protect me or protect somebody else from going through what I went through those 31 days, go get the vaccine.
Do some actual research, go on Johns Hopkins, these better sites, and also research how many people have died from the vaccine and how many have died from COVID.
To this day, David says he still has memory loss, brain fog, and fatigue associated with his time battling the virus. To read more of David's and Colleen's story, head to fox43.com. 2 years of the virus, and now we're more prepared to fight it than before. Coming up after the break, Fox 43 reveals the most recent outlook on COVID-19 treatments and why the risks of using unapproved medications can outweigh the benefits. Even though we're still fighting the coronavirus, we're certainly more prepared. Vaccines are widely available, and antiviral pills for COVID-19 are rolling out at more locations in the area. Fox 43's Rachel Yankunis reveals a deeper look at the outlook of COVID-19 treatments.
Treatment for the coronavirus has advanced over the past 2 years. Pharmacies started receiving antiviral pills for COVID-19 in January.
The Merck product actually affects the DNA of the virus, and it just starts to create mutations, so it just can't work. Pfizer product's a little different. It works on a specific protease enzyme in the virus that is needed to replicate, and it just prevents that enzyme from doing what it's supposed to.
Only certain patients are eligible for the medications, but access is improving. 74 locations in South Central Pennsylvania now have the pills in stock. That's nearly triple the amount from 6 weeks ago when Fox 43 Reveals first brought you this story. At the time, Hillcrest Pharmacy in Lancaster County was still waiting on their shipments of the treatment. Now they have 80 courses available.
We are in the trenches here, and we are here to serve our own communities.
Clinical studies have explored the use of ivermectin and hydroxychloroquine to treat COVID-19. Doctors say there isn't enough evidence to show that their benefits outweigh the risks.
Why are those treatments so controversial?
The first issue is that well-designed studies do not show that either of those medications work. The second thing is that when you have a medication that is causing harm, like hydroxychloroquine, which can cause cardiac abnormalities, or ivermectin, there have been plenty of cases of patients overdosing on this medication and having a tremendous amount of side effects. We really don't want to use those medications.
To see which locations are carrying antiviral pills for COVID-19 in South Central Pennsylvania, visit fox43.com and click on the Fox 43 Reveals tab. I'm Rachel Yankunis, Fox 43 News.
And we asked Dr. Curley as well about myths he still hears about COVID-19 some 2 years after the start of the pandemic. The biggest one, he says, is that people believe they don't need to get vaccinated because of misconceptions about natural immunity.
I've personally seen patients that have had COVID 3 or 4 times already. So this is a very common scenario that people get reinfected with COVID. So the latest data really shows that it's probably variable from patient to patient.
And while Dr. Curley does add that natural immunity varies, it typically lasts longer for COVID patients who had more severe infection. He stresses the importance of still getting vaccinated after recovering from the virus for higher chances to avoid being reinfected. And if you do have continuing questions about the vaccine, you can check out the Fox 43 COVID-19 vaccine guide on our website. We have all the stories we showed you through the last half hour there, and the latest headlines regarding the virus also on our website, fox43.com.